Well, hello everyone, and welcome to Birmingham Bible Church's Winning Wednesday. That's right, it is that time again. Every Wednesday at 12 noon, we always like to give you some valuable and important information because we want you to win. That's right, we want you to win, and create some more wins no matter what. We want you to win in your finances and your health and your relationships and just in every area of your life. So we are so happy and so excited that you decided to join us today. I mean, we are just peacock proud that you decided to just join us and to get all this information, just to soak it all in. And so if it's afternoon, good afternoon to you, good morning, whatever time zone you are watching us, we just like to say thank you. Well, you are in for a treat on today. We have someone who is very dear to our hearts. For those of you who have questions about having a chiropractor, you've been thinking about getting your back cracked and your neck popped, or maybe you're just scared to get your back cracked
and your neck pop. We have someone here who can answer all of your questions. And so he is a chiropractor. His name is Dr. Lorenzo Hunter. And Pastor Mason and I usually and occasionally go up to Atlanta and we see him because he and his partner, Dr. Sanford, just wonderful people. And so we thought with next month being Chiropractor Month that what a better way to celebrate it by having him on today. And Joe, so just to tell you a little bit about himself, he is, of course, a doctor of chiropractor. He works at Atlanta Spine Doctors. He has plenty of years of clinical experience in treating patients with pain without the use of drugs, because, you know, anything you take in, it goes to your liver and can damage, can cause other side effects. And so he believes in relieving pain without the use of drugs. And of course, many of you will appreciate this. He studied biology at Alabama A&M. Okay, so I guess kudos and shout outs there. And then also he attended Life University and got his chiropractic degree. And so, of course, what I like about Dr. Hunter is that they have the latest technology in treating injuries, in treating pain. We've been to several chiropractors and they do have the top of the line products and technology. And so if you have sports injuries or inflammation, you have arthritis, if you have herniated disc, they can treat that. And so he is just awesome. He is not a quack. I know a lot of times when people think of chiropractors, you know, even doctors, you know, you're kind of concerned if they're quacks or not. But when you go to their facility, they just have wall-to-wall pictures of people they have treated. I'm talking about famous athletes, musicians. And so we are excited on today that we have Dr. Hunter. And so I'm glad that he could take time out of his busy schedule to be able to meet with us and to join us on today. So everyone, please receive our guest for today, Dr. Lorenzo Hunter. Hello, Dr. Hunter.
Hello, good afternoon.
Good afternoon, how are you?
I'm doing well. Glad to be here with you guys once again. Thank you.
Good, thank you. Thank you for joining us. And so tell us before you get started, how did you get into, or what made you want to get into chiropractic work? I know I'll be nervous about popping somebody's neck. So how did you get into it briefly?
Yeah, well, during my years at Alabama A&M, and even before, I mean, I grew up as an athlete, played football my entire life. By the time I got to college, I suffered from a lot of lingering joint-related injuries. Basically, I got to the point where I didn't want to play sports anymore because I felt like if I'm already feeling these types of things at this early of an age, how would I feel later? I grew up not knowing about some of the benefits of chiropractic treatment and how they could not only help prevent certain joint issues as well as systemic issues, but as an athlete, I was more concerned with, of course, more of the pain prevention, so to say. But I did meet someone at one point during my college years who actually had a conversation with me about the benefits of chiropractic care. It really resonated. I always wanted to be a physician. At the time, I just wanted to be a general practitioner. And as I got into learning more about the benefits of chiropractic care and how chiropractors are able to help people in a totally different dynamic, it really interests me. So it was something that I really wanted to look further into. Basically, just fast forward to my later years in college, I decided to apply for Life University, where I was accepted in Marietta, Georgia. And from that point, later on in my career, school career, I was able to work on one of the patients, or people who I held very dear to my heart, which was my grandmother, who had suffered from arthritis issues her entire life. So I knew if I was able to help her with chiropractic treatment, then I would be able to touch and help numerous other people along the way. So really glad I made that decision.
Good. Well, and what an awesome testimony that is. Awesome. And so now you're pain-free or reduced pain?
Pain-free, reduce. Well, I'll say reduce pain. look, I'm a chiropractor. I still get my treatments on a weekly basis. I have to do my prevention just as my patients do. Sometimes they'll come in the office and they'll see me getting adjusted. And they're like, wow, doc, you get adjusted as well? Of course I get adjusted.
Wow, wow, awesome. Well,
Yeah.
well, tell us about what chiropractor is. Go ahead and tell us about that.
I'm sorry. What was that again?
No, I was saying, go ahead and tell us about chiropractic work and what's involved in it and how it can help us.
Definitely. Yeah. So, of course, most people are usually introduced through chiropractic services by way of auto accidents, typically, or just having some type of what we would consider to be an insidious pain on set. Just kind of, wake up one morning, have some type of a pain out the blue. They'll usually seek chiropractic services. Now, with myself as well as my partner, we made sure that those people who are coming in for those types of situations understand the overall benefits of chiropractic care. And we let them know we're not just chasing pain symptoms. However, of course, we are going to treat patients for those symptoms, but chiropractic is rooted more so in preventative care and maintenance for the body overall. So a lot of our patients are longtime patients at Atlanta Spine Doctors, people we've been seeing 5, 10, 15 years now, who just understand the overall maintenance of it. And of course, during the PowerPoint presentation today, we're gonna talk about two different topics that I just want to outline, which is going to be heart health, and we're also going to talk about ergonomics as well, and how those things can contribute to day-to-day people's day-to-day lives, and how we're able to help in those areas. Again, being that heart disease is one of the leading causes with death still in the U.S. And right now with COVID, with the COVID pandemic, for the last 2 years, most people have been working from home. So most people have been working in unfamiliar settings, so to say. You go from working in an office setting, sitting for 8, 10, 12 hours a day, to sitting at home at your kitchen table or dining room table, or even on the couch. Totally different dynamic. It affects the body in many different ways. So we're going to also talk about that as well.
Good. Okay. Well, you can go ahead and have way. Please talk to us.
Okay, definitely. I'm going to get this PowerPoint up here.
All right. And then I've made you a co-host, so you should be able to share as soon as you pull it up.
All right.
Awesome.
Awesome. And actually, before I get into the PowerPoint, I also have a quote that I would like to also show on the screen. So this is one of my favorite quotes by B.J. Palmer, who is one of the founders of chiropractic. But the quote says, "The preservation of health is easier than the cure for disease." And Lady Pam, are you able to see that on your screen?
Oh, yes, I see it fine. It's perfect.
Just wanted to make sure. So, all right, just wanted to share that before we kind of got into the PowerPoint here.
And you're right, because it's so much easier just to make sure you don't get sick. Once you get sick, man, it's just a lot of medication, it's treatments. And so you're right, if we just go ahead and try to do things on the front end, they can prolong or eliminate some of that stuff on the back end. So you're right. Yeah,
Definitely. Most times we let some of these things let things get out of hand, and it gets it comes to a head, and at that point we're kind of in dire need and have to do something about it, and we will always end up spending a lot more money and time to address the issue later rather than earlier. So that's definitely important. So all right, so the first topic we're going to talk about today is going to be cardiovascular health. So again, as I already said, heart disease is still one of the leading causes of death in the United States. We have actually the number's a little bit higher. You have close to over 700,000 people that dies a year from heart disease in the United States. And most people, think that these are people of age, older age, but that is not the case now. We are seeing a rise in younger individuals also that are having heart attacks. Of course, secondly, you're going to see cancer, and then you're going to see respiratory, diseases and so forth. But again, heart disease is one of the leading causes for men, women, and people of race, most racial ethnic backgrounds in the U.S. So we have about one person that dies every 37 seconds in the United States from cardiovascular disease. So that's about close to 650,000 Americans dying from heart disease each year. So again, that's 1 in every 4 deaths in the U.S. Right now, the U.S. spends about $219 billion a year in the care and treatment for heart disease patients. So that equates to, cost to rising costs in healthcare services, of course, medicines, and then a loss of productivity in the economy and the work area as well due to deaths. So I like to ask this question to people. It says, what day does most myocardial infarctions occur? Of course, heart attacks. And I always like, of course, on what day now?
Say Monday when people got to go to work.
On Monday, right? On Monday, yeah. So, yeah, actually, you are correct. Yeah, Monday. So, yeah, the research does show that on Mondays, most heart attacks will usually occur. And that's usually because of a lot of the stress hormones that are surging in the body. Most people spend their time enjoying their weekends, doing the things that they want to do. And then, come Sunday night, Monday morning, they're stressing about having to go back into the work environment, dealing with, coworkers, management, whatever it may be that they don't like. And that will usually cause a surge of bad hormones in the body. It says that most of those heart attacks will occur between 6 a.m. and noon on Mondays. All right, so the facts of heart disease. Every year, about 805,000 Americans have heart attacks. Of these, 605,000 are first-time heart attack patients. 200,000 happen to be people who have already had a heart attack. So about 18.2 million adults aged 20 and older have coronary artery disease. That's about 6.7%. So I highlighted that in red because I just wanted to kind of stress, how significant that is. And, 18.2 million adults aged 20 and older, that's very young. So again, as I said earlier, most people think that heart attack patients or people who are dealing with cardiovascular issues are people in the geriatric population, and that's just not true. So, so the people who are listening, the things that we're doing now, or that you have done at a younger age, are the things that would typically come back, to show up at some point later on in age, and it can show up earlier as well. So, but about 2 in 10 deaths from cardiovascular disease happens in adults less than 65 years or older. So the heart attack rate has increased dramatically in those under 40 years of age over the last 10 years. And there's a lot of factors that contribute to that as well. Of course, lifestyles have changed. We have a lot more younger people, who are, how can I put it, juggling a lot more things with their careers. They're looking to, move along in life, as I always say, a little bit faster. So they are also dealing with a lot of the stresses from work. They're dealing with, stresses at home, children, lots of different things, as far as socioeconomic status and progression goes. So why? Question is why. So risk factors such as diabetes play a role, high blood pressure, of course, smoking, stress and depression, which we're all going to talk about. For heart disease in young adults, we have about 800,000 heart attacks that occur every year, as we already said. Again, young adults account for 20% of them, bringing the total to about 160,000 young adults under the age of 40 that will suffer from a heart attack. All right, so how do we reverse this trend? Is the question. So I kind of added this slide. I added this slide in just to kind of help people, understand, blood pressure, and those numbers associated with blood pressure. So when you're looking at a normal blood pressure, 120 over 80 is going to be normal in most people. Anything elevated above 120 to 130 is usually borderline. And of course, above that number, then that's when we start getting into hypertension stage 1 and so forth. Things that you can do to help actually lower your blood pressure. So I always recommend different supplements to patients to help with things such as blood pressure. Pink sea salt being one of my favorite. Most people love salt. And the human body actually has an affinity to sweet and salty. Anyway, selenium, magnesium, vitamin C, something called glycolic capsules, which a lot of people haven't heard of. But those are actually capsules that are sold in health food stores to actually help with some of the trends and things to have actually lower blood pressure. Basically, aloe vera juice, which is great also to actually help with arterial, strengthening the arterioles, helping to ease circulation through the vessels also. And then on the right, you're going to see foods that actually help lower blood pressure. So raisins, bananas, of course, dark chocolates are very good. I also recommend dark chocolates to those patients who are also diabetics, because we know that dark chocolates also have very other good properties to actually help not only lower blood pressure, but to also help lower blood sugar as well. Of course, alkaline water, spinach, garlic, oranges, sunflower seeds, and so forth. And of course, the list is there for you to see, but these are things that can help lower blood pressures. So since we're talking about heart health, we cannot not talk about cholesterol. So cholesterol also plays a role in cardiovascular health. So the normal cholesterol level is going to be, and it should be less than 200. Again, as we get to that 200, 240 range, now we get into that borderline elevated level of cholesterol. And you're going to also notice here on the left, you're going to see LDL cholesterol, HDL cholesterol. So when you see this, you should always think of the LDL cholesterol, again, as the bad cholesterol, and the HDL as the healthier. So we always say, H or, happy cholesterol or something like that, just to make it make sense or an easier way to remember it. But you always want the ratio between the two to be pretty well balanced, so to say. So for instance, anything higher than 50, when you're talking about LDLs, is going to be good. So you want to be 50 and above with the LDLs, and you always want those LDLs, again, which are the bad cholesterols, to be less than 30. So And that's pretty much, again, just, the LDLs and HDLs, which we just talked about, just basically the differences between the good and the bad cholesterols in the body. So, and that last point there, it says, as your blood vessels build up plaque over time, the insides of the vessels, they start to narrow. This narrowing blocks blood flow to and from your heart and other organs. And so when blood flow to the heart is blocked or stagnant, it can cause angina pain, again, which is chest pain, which can also lead to heart attack also. So, all right, so the best cholesterol lowering foods, but I put this chart on the left because just wanted to kind of, depict, show a picture depicting the healthier vessels, which is going to be, of course, the one at the top. And on the bottom, you're going to see a blood vessel that has plaquing. So again, anytime you have a buildup of these LDL cholesterols over a period of time or years, it does have a higher likelihood of developing plaque, again, which is going to cause a narrowing of those arteries, causing stagnant to no blood flow in certain parts of the heart and other areas of the body, again, which will lead to complications, heart attack being one. And on the left, you will see foods that are great for helping to lower cholesterols also. So, of course, cashews, almonds, pistachios. Again, you're going to see that dark chocolate there, the green teas, the sweet potatoes, things of that nature. And what are the effects of chiropractic treatment on the heart? So that was a study done in 2007 that basically said that chiropractic adjustments could lower blood pressure without meds, which is a very interesting topic. So I would also advise you guys who are listening to also go and do some of the research yourself behind this. So again, that study in 2007, it showed the average reduction of 17 points in systolic blood pressure and 10 points in the diastolic pressure. So, and I forgot to kind of talk about the systolic, diastolic numbers, but the systolic number, again, is going to be that higher number when you're talking about blood pressure, that 120 number. The diastolic number is that lower number, that 80 number. So this groundbreaking research links blood pressure problems directly with a minor neck misalignment. Very interesting. So a lot of people ask, and I tell people that, we can actually help regulate or lower blood pressure with chiropractic adjustments. Most people, first question is how, I'm just here to get an adjustment for pain, what good is an adjustment going to do? So on this chart here, you basically see on the left a picture of the brain and of course the spinal column. And you see it shows that at certain areas of the brain as well as the spinal column, you have nerves, these various nerves that come out that controls different areas of the body. So everything in the body is controlled by nerves that are exiting the spinal column that goes to those areas. So one of the nerves that you're going to see that helps control the heart is going to be what we call the vagus nerve here, which is going to be a nerve that supplies multiple organ systems in the body. Vagus nerve is a very, very important nerve. The innervation from that nerve comes from the uppermost cervical area in the neck and carries down to the chest area to the arch of the aorta of the heart and controls what we call baroreceptors, which are basically just pressure receptors. So they controls vasoconstriction and dilation of those arteries. So when we deliver the adjustment to the upper cervical area of the spine, it actually helps stimulates the vagal nerve, helping with dilation of the heart. So we'll see within the first couple minutes of upper cervical adjustment, we'll see a decrease in blood pressure.
Hey, Dr. Hunter, I had a question.
Mhm.
And looking at your diagram, I see at the bottom, the uterus and ovaries. Is having adjustments good for women who suffer from infertility? Is there any research on that?
Yes, it is. Actually, there's tons of research out about that. It is. I have actually had quite a few patients that have come in. Of course, I can't say anybody's name, but I have had a few patients that have come in who were having some issues with fertility. And in the beginning, I will say one of those patients in particular, I didn't know that they had been trying to get pregnant for about, I want to say it was about 12 or 14 months, something like that. Both the wife as well as the husband, both were having some lower back issues. The husband was a construction worker, had, fallen off, a few ladders, roofs at times. And his wife would tell me, hey, I'm going to eventually get him in. He really needs to see you. Of course, she was being treated for the problem she was having in her back. But I did find out at a later time, as I was having a conversation with the husband about this same chart, and that came up, and he brought it to my attention that they had been trying to get pregnant for several months, and that he noticed his wife didn't get pregnant until they both started coming in to have adjustments done.
Well, it was nice knowing you, Dr. Hunter. I'll become AC. I'll just play.
Yeah, it happened. I have seen it happen on several occasions. Again,
Wow.
And one of them being a good friend of mine that I played ball with, his wife having a fractured tailbone from a car accident. I actually asked them if they had been, preventative and, again, trying to have kids. No, no. I told them, hey, just know that once we start doing these adjustments and focusing on that area, you may want to be mindful of that. Within a month's time, I got a call.
Wow.
We weren't trying to have any more kids. So, but yeah, I have seen that more than one occasion. And yes, there are tons of research out about how, chiropractic adjustments are able to help with infertility issues. Because again, remember, the nervous system does control every organ system in the body. So if you have any kind of misalignments in the spine, again, those things are going to cause pinched nerve issues because the way those nerves exit out of the spine. And again, that will cause a downregulation within different areas of the body. So again, it does, lower efficiency of functioning of the body. So yes.
Okay, thank you.
Mm-hmm. All right. So on this diagram here, again, this is just basically, I just wanted people to kind of get an idea of that vagus nerve and where it runs from. And again, if you look, you can see that this nerve does run through the upper cervical region of the spine. And again, as I told you, it travels all the way down to the heart. And again, this nerve being so very important as it is, it controls various different areas of the body. So very important nerve. And this is a chart that I keep handy. And I always, I always share this chart because again, I have permission to, but this is a chart. This is my the numbers I used for my grandmother when I was treating her for high blood pressure. And again, she had always suffered from, again, arthritis pains. Of course, she had suffered from high blood pressure, since I could remember. And I actually started kind of taking these numbers a little bit later than I probably should have during the course of her treatment. But you can see on September 9th of 2013, her blood pressure was about on average, her blood pressure was always about 150 is what it was before that time. And it all of a sudden, with some of the health and eating habits that she adopted, again, coming in, getting regular chiropractic treatment, at least for her in the beginning, it was like 2-3 times a week because of the things that we were working on. Her blood pressure dropped drastically. And again, you can still see fluctuations in the blood pressure, but overall, her blood pressure was much better than it had been over the last 20 plus years. Even at points, her blood pressure at the time was lower than mine. So because of these changes that we were having, the doctors didn't change her blood pressure medicines as they should have been doing, along with the Lasix and the water pills and things she was taking. and it did cause some changes in other areas. And she ended up suffering from something called hypokalemia, but basically her sodium potassium levels in her body ended up being thrown off drastically from these changes not being made. So, but again, we did get it back on track, but this is one of these success stories, and a little bit of research I was able to do years ago before, even getting into practice. All right, so now we're just going to talk briefly about home and office ergonomics, which is something that's very important, especially, again, during this pandemic when most people are working from home, sitting at a desk. Just as this guy is here, of course, it's funny to see this guy with a chain on his arm attached to a computer. But most of my patients, especially nowadays, let's say that being that they've been working from home during COVID, they feel that they spend a lot more time sitting, and they feel like they're busier at home than they were when they were in the office space. So, but this slide, basically just getting into the slide, it basically just talks about how detrimental sitting long periods of the day or hours could be to the body. Again, the body was designed to be mobile, to move around. So when you're sitting, again, it's going to cause posture issues. Of course, it's going to affect oxygen going through the body as well, leading to different issues, which we will talk about also. So the vicious cycle, what causes bad posture? So of course, unsupportive shoes. We know stress does, of course, accidents and injuries, mattresses, unsupported mattresses, hunching, chairs that are too high or low, cell phones below eye level. Again, text neck is the new phenomenon now. So most people, when you're out now, you see most people in this position now holding their phone. So most people have some type of a forward head lean or postural issue, whether they're sitting down or working in the office setting or not nowadays, especially the teenagers. So what are the effects on the body? So of course, we know decreased neck and shoulder ranges of motion, neck pain accompanied by ridiculous symptoms, which is traveling pain into the extremities, whether it be the arm or legs, decreased lung capacity from slouching, and decreased energy, headache, degenerative disc, digestive issues, low back pain, carpal tunnel issues, the list goes on. So when you look at this picture here, you can see that the young lady on the right, she's using proper sitting protocols and techniques, whereas the guy on the left, of course, he's holding his lower back, but then, you can see, how he's sitting. He's slouched, kind of leaning forward, feet not flat on the ground, chair not adjusted as it should be, of course. So, which is, most people on a day-to-day basis, are not really thinking about how they're sitting in their seat or are not consciously aware of it. But if we go back over to this list on the side here, one of the things I like to point out to people, we talked about decreased lung capacity from slouching. So I always have people sit up straight in their chair, and I'll have them take a few deep breaths in and out, of course, and blow out so they can see, you should notice how much more air fills your lungs, and how much more air that you're able to blow out compared to when you slouch in your chair and you take those deep breaths in. Basically, it kind of feels like a blockage is there. You're not, your vital, what we call vital capacity or ability to pull air into your lungs is not as great as it should be. So what does that do? That affects the body in several different ways. First and foremost, you're not oxygenating your blood as you should be. So the less oxygen that you're actually taking into your lungs, the less air that you're taking into your lungs, the less oxygen you're pushing into the systemic circulation or blood circulation of your body. So again, that can cause things such as what we call hypoxia, a lack of oxygen in the body. That's going to affect the musculature of the body. That will lead to tightness in the muscles. It can also lead to those headaches that you get during the mid part of the day after you've been sitting at your desk for the first 5-6 hours of the morning. So that can affect you in many different ways. So I always tell people, just make sure at some point, throughout the day, you take time to stand up, take time to stretch, take a few deep breaths to kind of counter some of those effects. And the proper workstation ergonomics, of course, it should be, top of the monitor should be at eye level or just below it. Of course, you want to be in arm's length or reach of the keyboard. And you want a minimal bend at the wrist, just as we seen the young lady on that picture. So you're talking about elbows being at about 90 to 120 degrees. Of course, you want your back straight, feet flat on the floor. I always tell people, make sure that you have an adjustable chair also. That really helps as well. And the last bullet point there is also important. So of course, not only do you want to have your feet on the floor, but I always tell people, make sure that you're not sitting all the way back in the chair where the front of the chair is actually pushing on the back of the knee. That can also cause some issues. It can kind of stifle blood flow into the lower extremities. Also, don't want that to happen, of course. So just be mindful of those things. So again, when you look at the young man here, of course, he's using proper workstation ergonomics. He's sitting up straight, head back, feet flat on the floor. The back of the chair is not pushing into the back of his knees. And he's not really putting any stress whatsoever on his neck or upper back area either. All right. So just kind of talking about the foundation, again, being your pelvis, sacrum, and lower back or lumbar vertebra. So sitting increases the lumbar load by 40%. So again, it's very important throughout the day just to get up, move around, stretch a little bit, because just sitting in a chair puts quite a bit of a stress load on the lower back, because of course you're having to maintain those postural muscles throughout the day. Of course, sitting in slouches increases that load to about 45% of the body weight. So improper sitting posture can lead to deterioration of the intervertebral disc, or the disc, which are the little soft cushioning pads in between the spine. Due to uneven increased load, and lead to degenerative disc disease, which will decrease mobility in the spine. This position can also have an effect on your digestive system, as this position compresses the GI tract, putting more stress on the digestive system as well. So when you increase the stress on the GI tract, that can lead to irregularities in the bowels with a decrease in frequency also. So again, standing up, every hour, couple hours to stretch, move around, be very vital. All right. Also, as we mentioned, anterior head carriage also puts an increased load on the vertebral column as well. So again, it's very important making sure you're sitting up straight, that you're not always in this head first position. Most people who have very bad postures, who do a lot of sitting, we tend to see them come in with a lot more headaches, a lot more vertigo issues, or dizziness, things of that nature. Of course, the numbness, tingling, or the traveling pains that radiate down into the extremities, into the hands. A lot of people will suffer from this and think that they're dealing with some type of carpal tunnel issue. And in a lot of situations, it may not be carpal tunnel. It could be a problem here in the neck. So we find that a lot also. All right, this chart right here, again, this is another chart just kind of showing you how those nerves basically branches out, where they branch out at, and how they run throughout the body. So if you go down to where you see the axillary nerve supply, what I wanted people to see is how these nerves from the neck actually comes down and connects at some point, and all of these different branches run down into the arm and hands. So again, a lot of problems that people are dealing with sometimes in their shoulder or upper extremities, a lot of time it comes from their neck. Have people come in all the time, say, hey, I have a problem with my right shoulder, left shoulder, whatever the case may be. First thing I ask them, did you have an acute injury? Did you fall? Did you injure it in the gym? Did you hit it in any kind of way? A lot of times they'll say, no, I haven't been doing anything. I just woke up one morning, or, I went to take the trash out or something, and, next day my shoulder was hurt. Well, most times, I'll know from that, it's probably not your shoulder. This is probably an issue coming from your neck. And in most situations, it is. All right. And really quick, this is just something that shows the different phases of spinal degeneration. The first picture here, of course, you will see that the neck is in more of a upright position. You should have this reverse C-shaped type of a curvature in the neck. Most people will come in and have more of a straight neck or anterior or forward lean in the neck. And as we get into phase 2, you start to see how the disc area, the little cushioning areas in between the bone or vertebra, are starting to deteriorate, and those bones are starting to come closer together. And by the time we get into phase 3, you can see that in certain areas, you can't really see the joint space anymore. You start to see bone spurs, or these little things that are coming off of the bone here. Those are bone spurs, or what most physicians just say arthritis that you see, but it starts in these earlier phases, right around phase 2, between phase 1 and phase 2, actually. So those types of things can be very painful, again, because of the deterioration here in these discs, along with the misalignment issues. The tendency to cause some pinching of those nerve endings is that much higher, because again, those nerve endings do exit right around these areas here, or I'm kind of moving the mouse. All right, we'll kind of just basically kind of talking about what we already talked about, posture, but we'll go down to this last slide, and again, just kind of touching on what the lung capacity that we talked about. So when you're slouching and you have more of what we call a kyphotic curvature in that mid back there, this does decrease lung capacity, and it deprives your body and brain of oxygen, therefore decreasing brain activity and depleting energy storage. So again, we talked about that earlier, during that noonday time, how most people will tend to get very tired, or lethargic, lose concentration, focus. And then you usually take a lunch break, go to lunch break, eat a really good meal, come back, and at that point, you're just tired and you're no good for the rest of the day. That may sound familiar for most of us. So why chiropractic? It shows that people who are suffering with lower back, this study shows that people who were suffering with low back pain that were prescribed medications versus spinal manipulations, they had improvements in both categories. But it shows that 94% of those patients who seek chiropractic manipulation actually had a 30% reduction in lower back pain at week 4, whereas 94% of those people, had a reduction in the 4th week, whereas 56% of those patients had a reduction of pain in 4 weeks. So both improved again, but it just shows that there was a higher percentage of people who improved in that same time frame who was receiving chiropractic manipulations. And now we're talking about the likelihood of surgeries for workers with back injury. So it shows that 42% of those people whose first point of contact was a surgeon ended up having a spinal surgery, whereas 1.5% of those people whose first point of contact was a chiropractor did have a surgery as well, but it was much lower. So you're talking about 42% compared to 1.5% of patients having to have a back surgery. So basically that's just saying that, again, chiropractors are able to prevent surgeries in most situations. by some of the different techniques we use. Of course, more than just the adjustments, but at our office, we actually implement things such as spinal decompression as well as deep tissue laser therapy to actually help speed up the healing process for people and to also treat herniated bulging discs and a lot of those things that people will have to have surgeries for. And then the benefits of chiropractic care, again, maintaining proper spinal alignment, restoring proper range of motion, maintaining joint lubrication, because again, anytime we're freeing up the fixations in the joints by realigning them, it does help increase joint lubrication, also preventing arthritis. At least it helps slows down arthritis, the arthritis process. Of course, prevents pinched nerve syndromes and more efficient nerve functioning. And it does help increase immunity as well. So again, there's a lot of research out there about that. Also, that's the other side of chiropractic, like as I mentioned earlier, not just the pain part of it, but the overall efficiency and productivity of the body. And again, increasing the immunity is one, because everything we're doing is centered around increasing nervous system flow. Anytime you help increase nervous system flow and health, you're going to actually help with increasing immunity. So there's research out there that shows that 30 minutes after chiropractic adjustment, it actually helps to increase what's called the phagocytic or white blood cells, which are disease fighting cells in the body. So again, it actually does help with, again, that maintenance and prevention, in disease. All right, achieve your peak potential through chiropractic. All right, Lady Pam, that's going to be all for me today as far as the slides go. I do want to point out that the information on the screen is correct, with the exception of the address. The address has been changed, and the current address is 4 Concourse Parkway, and that's going to be Suite 110, Atlanta, Georgia, 30328 is the current address. This office is no longer operating in the Marietta area. We now just have the one office in the Sandy Springs or perimeter area now.
This was awesome, Dr. Hunter. In looking at it, I didn't know how, having adjustment, we typically think about, having adjustment is when I, have headaches or I have joint pain, but it also helps with those medical issues that a lot of people have. And so I know we talked about heart health and blood pressure. We talked about infertility. What have you seen personally? There's some other things that chiropractic adjustments have helped with from a medical standpoint.
Yes, good question. So I've seen, I'll say I have patients that I have been able to help with things such as fibromyalgia, with seeing less flare-ups of fibromyalgia, or at least being able to implement like the adjustments along with the laser therapy to actually help and shorten up the flare-up times, so to say, from something like fibromyalgia. I've also seen patients who've come in with something like Bell's palsy, which is like a unilateral paralysis of one side of the face or body, which is temporary. It's not permanent. Again, it's something that would, a person, could wake up with one morning and, it just comes out the blue, and eventually it does go away. But I have had patients come in who have had repeated episodes of a Bell's palsy, and they come in and they see that with the chiropractic adjustments, with the laser therapy, that those episodes are much shorter. I've had a patient who was having those episodes whenever they would flare up. She said it would take at least 3 weeks for it to go away, sometimes longer. We started doing chiropractic treatment on her, and by the time we got to our 4th visit, she was basically back to normal. By the fifth visit, she was back to normal. Everything was gone.
Wow.
Yeah. So, so those are, a few, but even changes with diabetes, because again, we don't necessarily say we treat, but we do help
Right.
co-manage different ailments.
Right. That's why I said things that you notice, because I know you can't claim that, it does something particular, but you have noticed. I mean, and patients talk about it. Hey, since I've been coming to you, I've noticed my blood pressure is decreased. I don't have to take as much meds as I used to. My doctor has readjusted my medication. And so all those things are important. I really also liked your what you said about ergonomics, because it's so, and when it's hard to get out that habit. And I remember coming to y'all and y'all were saying that hold the cell phone up like this and text, as opposed to being down here. It is so hard to get out that habit, but it's things like that. It's making sure we have great posture. The deep breathing, I forgot about that, but just how that deep breathing just helps get all the oxygen to where it needs to be so that you can perform better. So I liked all those tips. Those are great tips. And so what I'm getting from your presentation, that it's not only just the adjustment, it's also the lifestyle that we have after the adjustment. It's the, making sure we have great body posture. And you also give, per patient, y'all give out some homework assignments as far as what we need to do or not to do, and exercises. But I also want to add, so if somebody's going to a chiropractor for the first time, what are some things they should expect that first visit? And then if you can tell us, if somebody's going to a chiropractor and maybe some warning signs they need to change a chiropractor, can you give us something about that as well?
Yes, definitely. So, things that you should expect on your first visit, you should expect, of course, first and foremost, a consultation to get a better understanding about what it is that you're dealing with and how that person or that chiropractor is able to help you. You should also expect x-rays. A lot of us will do x-rays before the treatment. And that person should also be willing to educate you, again, on some of the benefits of chiropractic care and how how it will help you as well. And me personally, I like to, keep an open lines of communication with my patients by explaining to them, look, if you don't like, or don't think you would like to be manually adjusted, you don't want to hear that pop, when the adjustment is done, let me know. There's multiple ways to do this. We can use what we call an activator tool, which is like a handheld in-post instrument that you just basically put on an area of the spine. It's just a click, but it's an impulse tool. So it does the adjustment without you feeling any of the popping, clicking. And sometimes you just have to ease people into that. You can't start out that way with everybody. So you should expect that person to, again, listen to you and to tend to you and your needs. Now, and you also asked things that I guess like warning signs of going somewhere else. Was that the question?
That was a question.
Oh man, so well, I'll just say what feedback I've gotten from other patients when they go to other clinics. They will say that typically when they walk in, sit down, that warning signs for them may be the doctor harping on money and payments before they even sell themselves, or when it comes to treatment, them not really addressing what they came for, or at least them not understanding why they are addressing these other things. So sometimes those are signs for people. I've had several patients say that one thing I also left out was that, again, when I'm doing adjustments on patients for the first time, myself, I like to explain to them what I'm going to be doing, how it's done, and I'll do a demonstration without actually doing it to make sure that they're okay with it. Because I've had several patients come to me and say, I've gone to a chiropractor, and but I only went one time and I never went back. And most times when I ask them why, they'll say, well, they did this thing with my neck, and I wasn't prepared, I wasn't expecting it, and it really scared me, so I didn't go back. So I make sure that I explain and demonstrate to them what I'm doing before I do it, so they have an understanding. And if they don't like it, like I said, then we can do it a different way. Just building trust.
Okay, awesome. That's good. Well, thank you, Dr. Hunter. We really appreciate you joining us today. Before you go, I'm going to show an announcement slide, and then I'm gonna have you come back on and just give us some closing remarks of things that you want us to consider. So if you can bear with us for a few minutes.
Okay.
All right. All right. So thank you everyone for joining us here on today. Of course, our theme for this year is Reconstruction 21. And so of course, we are believing God that he will reconstruct everything in your life during this year. And then there are several ways that you can be and stay connected to us. We stream live on YouTube, on Facebook, on Twitter, and on Instagram. And then you can also stay connected with us through the My Sunday app. Simply go to your app store, download My Sunday, which is one word, and then you can locate Birmingham Bible Church. From here, you have numerous ways you can connect. We have notifications. All of our flyers of events are there. And also, you can also watch us through the app as well. And then you can also stay connected with us by receiving text messages. Simply text BBCWW to 94253. And then we have a business directory. If you have a business or you know someone that has one, please go to our website, bhambc.org. Make sure you click on business directory at the bottom and then key in your information. This is free, free service. So all you have to do is go to our website, bhambc.org, and then submit your information. Your information is not only just a part of our website, but also a 50,000 plus Christian database. So of course, it's imperative that you sign up for that. And then every Tuesday at 11 o'clock a.m., we have a study in the scriptures. We are actually walking through the book of Philippians, and what a great time we are having. If you miss any of it, it's okay. You can go back and watch it on YouTube, on Facebook, and of course on Twitter. So you can do that today. And then, of course, today you heard from Dr. Lorenzo Hunter. We had a great lineup of people this month, y'all. So make sure you go back and watch it. We have a great lineup for next month. So can't wait to share that with you guys as well. You can always go back and watch these. And make sure you're sharing it with someone. You want to share with your family and share with your friends so that we can all be empowered. And then we have various virtual hangouts that we have on a weekly basis. So of course, make sure you're attentive to each and every one of these. Our small group is going to take a little break, but we'll be back so we can continue to learn how to tame our tongue. So that's also was a great small group lesson that we had. And then we are doing a new summer series. Pastor Mason is going to deal with family issues. We're coming up to the holidays, y'all. We need to learn how to deal with those family issues. And so he's going to deal with a lot of topics, single and tremendously blessed, lasting marriages. Is it generational choices or generational curses, even blended families? So he's going to tackle all the issues. So make sure you're watching us, of course, on all of our social media outlets. And then our prayer room is every Monday, Wednesday, and Friday at 6 a.m. That number is 727-731-0433. We having a great time in there, y'all. It is awesome. The power of God moves in that prayer room. So it's imperative. It's a must that you join every Monday, Wednesday, and Friday at 6 a.m. That number again is 727-731-0433. And then we're having our virtual Women's Empowerment Conference. Excited about all of our speakers, all of our great topics. The theme is Built by God. You were built for this. You were built to be physically fit, to have great health, to be a super mom, to handle your business, to have a relationship with God, and to have great mental health. So we're excited about these topics, these speakers. Well, listen, to order your shirt, please contact Nikila Robinson Huggins. You can messenger her on Facebook, but her number is also 205-915-7989, and you can get your t-shirt. She can do any color t-shirt, any color writing, so not just the one you see on the screen, but she can do it all. So please contact her on today. And then thank you so much for your continued support of Birmingham Bible Church, just how you support the ministry as a whole. And so because of your gifts, we do a lot of great things, but one main thing that we do is we give to our 11 sponsored Compassion International children in Haiti. So thank you so much for that. Your gifts go toward their food, their medical supplies, their emotional needs, their educational needs, and their physical growth. So thank you so much for that. And then we're also believing God for land in the Birmingham area. So of course, we want to continue to do ministry debt free. And so we'll continue to do so. So thank you. Thank you. Thank you for your contributions as you sow sacrificially towards our land, our future. And then as always, we like to thank everyone for how you tell somebody about something that's going on at Birmingham Bible Church. We just believe, God, that He is going to do great things in your life. And we want everybody to win and to be empowered. And so the last thing we have is that October the 8th, we have a concert that's being sponsored by our very own Alexis King. This young lady is awesome. You can go out there and listen to her music. But the concert is October the 8th here in Birmingham. And I believe she said also Miles. She's going to be singing, Deidre Gaddis is going to be singing at Miles or performing at Miles the day before for I believe their homecoming. So make sure y'all support. Go to Eventbrite. Tickets are available there. They start at $30 and go on up. So please support our very own. And that's all we have. Please, y'all, like we always like to say, stay safe, stay sane, and stay sanitized. And so, Dr. Hunter, do you have any closing remarks, anything you want to tie up or wrap up as we get ready to close?
Yeah, sure. I'm going to actually again, I'm into quotes, but I do have one last quote I wanted to share. And this is another one of my favorite by Thomas Edison. This quote says, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, diet, and the cause and prevention of disease." Wow. Again, that's another one of my favorites.
Wow. And you are, of course, you're big into nutrition as well. So I remember that. So you're right, and it all works together. You know, the outside and the inside. You know, those foods that you put up there. And I'm familiar with the, I think you said colic. It's like garlic capsules, and so yeah, it's amazing how all those things that God made, you know, is to heal the body on the inside. We just got to take advantage of it and use it. So
definitely.
Awesome. So thank you for that. Well, there you have it, folks. You have now been informed on chiropractic care, the importance of it, all of the benefits of it. And so here at Birmingham Bible Church, we want to always encourage you. We want to enlighten you, and we want to educate you about certain topics pertaining to your life and your living. So thank you so much for joining us. Until next time. And thank you so much, Dr. Hunter. We'll see you soon.
I look forward to it. Be sure to tell Pastor Mason I said hello as well.
I sure will. I sure will. And you tell everyone that we said hello, Dr. Sanford and Jasmine, her mom, everybody. Tell them all we said hello.
I most certainly will. And again, thank you for having me.
Yes, sir. Thank you so much. Have a happy Wednesday, y'all. Have a great day.
You as well.
Okay.